Welcome. We will give everyone just a few minutes here to come on from previous meetings and engagements. But those of you who are already on the call, we would love for you to just introduce yourself in the chat and just tell us something that's bringing you some joy or peace right now. So please introduce yourself and tell us something that's bringing you some joy. All righty. Okay, I see. All right, I think we'll go ahead and get us kicked off today. Welcome, welcome. Please feel free to keep introducing yourselves in the chat. We are so thankful that you have joined us today for a webinar, a short two-part webinar series that we're calling The Air We Share. And this week is focused on outdoor air quality, specifically on heat and wildfires. My name is Jess Hinshaw, and I'm the Director of Environmental Health at NAC. And NAC and Migrant Clinicians Network are just thrilled to be two teams with you here who have worked in planning this webinar. Next slide, please. And we are so grateful to the Thoracic Foundation for supporting our work in respiratory health, specifically the MCN team. The content of this webinar may not represent the official views of the Thoracic Foundation, NAC, or MCN. Next slide, please. And with that, I'm going to turn it over to Martha to speak a little bit more about our continuing education credits.
Thanks, Jessica. Welcome, everyone. Just to let you all know that this activity is being jointly provided by MCN and NAC. And MCN, the accredited provider unit, maintains the responsibility for adhering to continuing education, educational design and criteria, and awarding of continuing ed credits. Let's go to the next slide. All right, MCN is accredited as a provider of continuing nursing education. And we have also filed an application with AAFP for continuing medical education. If you want to receive either a CME or CNE certificate, you're required to be present in the session at least 80% of the time and submit the post-session evaluation. Let's go to the next slide. And I will have to read the disclosure of relevant financial relationships. We have no relevant financial relationships that relate to this presentation, nor do we have any relevant financial relationships with ineligible companies whose primary business is producing, marketing, selling, reselling, or distributing healthcare products used by or on patients. And with that, I will hand it off to Jessica. Thank you, everyone.
Thank you so much, Martha. Next slide, please. So again, this webinar is brought to you by both NAC and MCN, and we just really enjoy working together and thinking about these topics and bringing training and technical assistance resources to you related to environmental health. So you can see all the names listed here on the screen that were part of the team to bring you this webinar today. Next slide, please. A couple of housekeeping items as we get started. This webinar is offered both in English and in Spanish. If you would like to see this webinar presentation in Spanish, please go down at the bottom of your screen. There's something that looks like a globe. that says interpretation, and you can click and choose the language, either being English or Spanish. Also, at the very top of your screen, you can see something that says English, Mac's screen, and something that says Espanol, Martha's screen. And you can click on either of those options and choose the presentation language that you'll be seeing. Next slide, please. Just a couple of additional items here. We are recording this meeting. We will send out a recording and a PDF of the slides after the session. It does take us a little bit of time to get the recording up and on YouTube and edited, but we will send that out afterwards. And again, please keep introducing yourself in the chat. And we will have question and answer towards the end of the session today. You can write your question and answer down at the Q&A box, and we'll either answer via written response or bring your questions to our wonderful presenters. Next slide, please. And these are really our objectives today. I won't spend too much time because we really need to get to our presentations, but really our objective is to talk about how heat and wildfires impacts patients and how health centers can be ready for these issues. Next slide, please. And our three presenters today are Dr. Maeve McMurdo, who's a pulmonologist at the Cleveland Clinic. We also have Nate Matthews Trigg, who is the Director of Climate and Disaster Resilience at AmeriCares. And we have Amy Liebman from Migrant Clinicians Network, who is the Chief Program Officer. So with that, we're going to get it started with Dr. McMurdo. So Dr. McMurdo, over to you.
Thank you so much for having me. A lovely day outside today, and that's bringing me a lot of joy right now because I need some sunshine. So, as Jessica mentioned, I'm a pulmonologist, so a lung specialist over at the Cleveland Clinic. And clinically, my work focuses on occupational environmental lung disease. But as a researcher, I do a lot of work with our local farm worker community, trying to understand how poor air quality and other environmental exposures are impacting farm worker health. And today I'm going to be talking about wildfire smoke, both in the context of heat and on its own, and really what we know and don't know about its health impacts. Next slide, please. So we're going to cover a couple of things today. We'll talk about what's changing with wildfires and really the trends that we're seeing. We're going to discuss what makes wildfire smoke different and why wildfire smoke is so hazardous. We'll talk about what we know and what we don't know about wildfire smoke and health, both for farm workers and the general population. And then I want to finish up with some practical tips about what we actually do about it and how I talk about wildfire smoke in the clinic when I'm talking to my patients about kind of action planning and next steps. Next slide, please. So as I think has become apparent to all of us, wildfire season is changing. And in the past 10, 20 years, we've really seen that wildfire season is starting earlier and lasting longer and impacting parts of the country that previously weren't really affected by wildfires. We've seen wildfire season shift, and so now we're seeing wildfires start as early as June and really last throughout the entire summer, which is a huge amount of time where people are exposed to poor air quality and harmful wildfire smoke. When we think about why this is, it's almost entirely driven by climate change. So hotter weather, drier weather, but also by things that we're doing in terms of forest management and increasing expansion of cities into the areas where wildfires have traditionally existed. So both human activity and then climate change itself is shaping our wildfire season and really making it much more severe for most of the country. Next slide. What we've seen with that is that the improvements we have made in our air quality have really been reversed. So the United States passed the Clean Air Act quite some time ago, and that was really effective. Across the board, air quality improved for almost every state. And while that wasn't equal, there were some states that still had worse air quality. We really did see a significant improvement in human health driven by improved air quality. But wildfire smoke is reversing this trend. This is actually older data. It's now worse than this. But for the Northwest, the West Coast, the Rockies, the Southwest, we're seeing that the average concentrations of particulate matter, PM2.5 in particular, are starting to increase again. They're going in the wrong direction. And that trend is just keeping on creeping upwards and upwards. So we're seeing now that the gains we've made, the progress we've made, has really been lost because of wildfire smoke. Next slide. We also know that wildfire smoke is not just a West Coast problem. And I think historically people have kind of framed this as being, BC, LA, California problem. But this is a map of wildfires in the United States on just a random day in June. And what you can see is that there are fires everywhere. So the East Coast has a large number of these smaller wildfires that really impact local level air quality. And we see these wildfires burning throughout the United States for almost all of summer, even in areas where historically we didn't have wildfires occurring. You can actually access this map in real time. It's a really good data source when you're thinking about your local level air quality. And it's scary, we're seeing that these wildfires are happening more and more frequently and kind of in more and more dense and more urban areas. Next slide. We know, and we have really good data at this point, that air pollution is not good for you. It has clear health impacts across the lifespan, starting from before you're born, with low birth weights and the risk of premature delivery, an increased risk of early childhood asthma and childhood asthma, and then into adulthood, an increased risk of heart disease, of lung disease, of stroke, of high blood pressure, of wrinkles, and probably most importantly, of early mortality. So globally, air pollution exposure is a major driver of early death. And that death actually comes mostly from heart disease and stroke, but lung disease, lung cancer, COPD, asthma, those are also all major diseases which are driven by air pollution exposure and get worse with the more air pollution exposure you experience throughout your lifetime. Next slide. When we think about what air pollution actually is, it's not just one thing, but really a kind of complicated mixture of particulate matter, which ranges from PM10, the kind of coarse particulate matter like soot, like agricultural dust, to this PM2.5, which is the thing we talk about really commonly because it's really easy to measure, this fine particulate matter that gets deep into the lungs. And then a range of gaseous compounds, so things like ozone, like nitrogen dioxide, like sulfur dioxide, volatile organic compounds, which all make up that kind of mixture of smog you see coming out of factories, coming out of tailpipes. All the components of air pollution are harmful to human health. So all of these in isolation can cause harmful health impacts. But together in one kind of giant smog mix, the health impacts are worse. And so when we're thinking about air pollution in general, it's not just one thing, but a lot of different things coming from a lot of different sources, which we're all exposed to day in and day out. Next slide. Wildfire smoke, though, is a little bit different in that wildfire smoke is not the same as normal air pollution. It contains more carbon because trees are burning, and that carbon triggers what we call oxidative stress or inflammation in the body. So compared to normal air pollution, which isn't great, the risk of inflammation in the heart and the blood vessels is probably higher. What's also important and often kind of under-recognized is a lot of wildfires now are not just occurring in rural areas in the forest. They're occurring what we call the wildland-urban interface, which is the area where city or housing meets the forest zone. And these fires at the wildland-urban interface result in both traditional kind of wildfire air pollution smoke, but also the smoke that comes from burning houses, from burning property. And that smoke is uniquely toxic. We see a lot of volatile organic compounds, we see benzene, we see lead, these cancer-causing harmful compounds. And particularly during the recent LA wildfires, we saw that the air toxicity, the stuff that was in the air, was very different, potentially differently harmful than the kind of classic wildfire smoke we think about. And as these wildfire urban interface fires happen more and more frequently, we're going to see more and more of this. Electric cars, when they catch fire, are not good for you. And quite more frequently, no car is good when it catches fire, but these compounds can really cause these unique and often under-recognized health impacts. Next slide. We know that exposure to wildfire smoke is not good for you. And there's really clear data that when these wildfire events happen, when wildfire smoke spikes, the risk of lung problems goes up. The impact is strongest in children and people who are elderly. And in one study, they found that during these wildfire events, the likelihood of an asthma exacerbation for children under 5 increased by almost 80%. So it's a huge increase in the risk of asthma flaring up. And these exacerbations, they can be life-threatening. They can require medication, they can require a hospital stay. They're really, really scary. And they're even scarier when they're happening in the setting of a wildfire event where you may not be able to access healthcare, or you may have a harder time getting to healthcare because traffic is bogged down, you can't leave your home, you're forced to evacuate. So it's not just the wildfire itself, but also the stuff that wildfire does to our infrastructure that can make it hard during these healthcare events. We see for children with asthma, for people with COPD, the risk of exacerbations increases, the risk of hospitalization increases, and the risk of using a rescue inhaler like an albuterol also increases. And even in people who don't have chronic lung disease, people who are healthy or think they're healthy, we know that wildfire smoke events increase the risk of things like pneumonia, of acute bronchitis, so infections in the lung, which can then again lead to more hospital stays, more healthcare resource use, and people who are sicker. So wildfire smoke is potentially really harmful for the lungs in ways that we often don't think about during the actual event. Next slide. We also know that wildfire smoke is not good for the heart. And we now have several studies from these wildfire events showing that during wildfire events, the risk of dying from acute heart attacks or myocardial infarction increases significantly. When we think about high heat, which often goes along with these wildfire events, that also increases the risk of heart problems. So for both respiratory, for lung problems and for heart problems, when heat and wildfire smoke occur in combination, the risk to health is much more significant. We see really this kind of combined impact. The data around wildfire smoke and other heart disease kind of complications is a little less clear-cut. And part of that is because it's actually really challenging to study and model wildfire smoke. I'm not going to bore you with the details of kind of why that is, but it's not like modeling or measuring normal air pollution exposure. And so it can be hard to tease out really what that relationship is. But we do think that most likely people who've got chronic heart conditions like high blood pressure, like heart failure, who've had a previous heart attack, are probably more at risk during these wildfire events than the general population. And what we tell our patients is that if you have underlying risk factors that you know about, so if you know you have high blood pressure, if you know you've got asthma, if you know you've got COPD, if you know you have heart failure, you should try and avoid and really minimize your exposure to wildfire smoke wherever you can. But that's often easier said than done. Next slide. The big question, and really the big unanswered question right now, is what long-term exposure to wildfire smoke does to human health. We have very little data or very little research right now about these long-term impacts. And the best data we have comes from our studies of wildfire firefighters, which have shown an increased risk of lung cancer and of heart disease, and wildland firefighters who have this ongoing season-long exposure to wildfire smoke. But taking that data and applying it to the general population is a little challenging. Wildfire firefighters are extremely physically fit, but they're also working right on the fire line, often with no protection, no mask, no respirator, and on the fire line for days at a time. So they're getting this really intense, really high level exposure to wildfire smoke. in these long seasonal periods. What we don't know, and what I really worry about as a clinician, is how this impacts people who work outside. So farm workers, for example, construction workers, transportation workers who are working outdoors and who are working during these wildfire events have a similar exposure to wildfire smoke as these wildfire firefighters. They're not on the front lines, but they're working outside, they're not indoors, they're not protected. And often they're working in high heat and other sort of hazardous conditions where the risk to health is already high. We know that farm workers are significantly more likely to die of heat stroke, construction workers too. And what's probably the case, what really remains to be answered, is whether wildfire smoke is going to have the same relationship, where the harms of long-term wildfire smoke exposure are going to disproportionately impact our sort of, again, labouring community who are labouring outside and who aren't really protected. I think what's concerning to me and what's kind of growing in data is that wildfire smoke has impacts from a really early age. Some really good research from Australia found that in women who are exposed to wildfire smoke during early pregnancy, the risk of birth complications, gestational diabetes, so diabetes during pregnancy, significantly increased. So it's not just heart, it's not just lungs, but air pollution and wildfire smoke really impact the whole body in ways that we still don't understand that well. Next slide. So what about farm workers? As I mentioned, farm workers are often not thought about as being exposed during these wildfire smoke events, but they are. They're working outdoors. They're often working in areas that are at risk for wildfires. And with things like the AgriPass system, which lets farm workers kind of work even when there are evacuation orders in place, farm workers are often exposed really at the front lines of these wildfire events. Farm workers also have other risk factors which make them more vulnerable to the health impacts of wildfire smoke. High heat, for example, pesticide exposure, dehydration, often under-recognized underlying lung problems. Our research here in Ohio is showing a high rate of asthma, and again, often farm workers don't have access to consistent healthcare and may not have a diagnosis. There's also exposure to other air pollution, so diesel smoke from farm equipment, dust from dry land farming. All of those things can act in combination and can really impact health in ways that we don't understand very well right now. Next slide. So we know from modeling, and this is only data from California, but really I think this can be extrapolated across the board, that an increasing number of farm workers and outdoor workers in general are going to be exposed to wildfire-related air pollution. This is really interesting modeling work from Marley et al., looking at predictions and the setting of climate change and how air pollution exposure and wildfire smoke exposure is going to shift. And you can see that across the board, really, the rates of exposure increase significantly for farm workers. Again, we don't know what this does to health, but prior research has shown that farm workers who are exposed to dust, so agricultural dust in particular, have a high rate of respiratory symptoms. And I think what's becoming increasingly apparent with my research is that the rates of underlying lung disease like asthma and COPD in farm workers are likely much higher than we previously recognized. We aren't screening these workers necessarily. There's a lot of pressure to stay healthy, to not complain, and to keep on working. And so a lot of the things that might get diagnosed in someone who was working in an indoor job get missed in our outdoor farm worker population. Next slide. Wildfire smoke also doesn't occur in isolation. So I mentioned that obviously climate change and wildfires are really linked. They're hard to avoid talking about in combination. And the hotter it is, the drier it is, the greater the risk of wildfires. Farm workers are already 20 times more likely to die from heat than other US workers. And there's growing data really showing that the harms of heat and air pollution exposure in combination are probably higher, up to a 30% increase in the risk of cardiovascular, so heart and lung mortality. And we see that people who are exposed to both high heat and wildfire smoke at the same time who are working outdoors are more likely to have traumatic injuries, so slip and fall, mechanical injuries. partially because, again, when it gets hotter, when it gets cloudier, it's hard to see and it's hard to work. And it's hard to wear PPE, personal protective equipment, when it's really, really hot outside and you can't breathe. So these two things, heat and wildfire smoke in combination, can really have a lot of negative health impacts. And there's some great data coming out of Washington State, which shows, you can see this figure on the right, left, the figure, that we see high heat and poor air quality days occurring in combination, particularly over the summer months when wildfire smokes are highest. Next slide. So I'm going to change focus a little bit here and talk about how I talk about air quality in the clinic. And I spend a lot of time talking about air quality because I think it's really important as a lung doctor to give patients practical tools to actually understand what their air outside is doing to their health. And the most important, the most straightforward tool is really the AQI, or the Air Quality Index, which I'm sure almost all of you have seen at some point right now. This is really something provided by the EPA that provides a guide for how healthy the outdoor air is. And it's generated based on the most harmful pollutant in the highest concentration. So it could be ozone, particulate matter, nitrogen dioxide, but it gives a guide about what you should do and how harmful the air quality generally is. So we tell patients, in the green zone, the air quality is great. You can be outdoors, you can do what you'd normally do. In the yellow zone, the air quality is okay, but if you have really bad lung disease, if you've got really bad heart disease, you may want to think about being indoors more during the high air pollution period, so peak rush hour, for example, and thinking about moderating what you're doing outdoors. When we get into the orange zone, that's when the air quality starts to become unhealthy. People who've got chronic lung problems, chronic heart problems, young children should really try and stay inside and avoid being outdoors, or avoid exercising outdoors when the air quality is at its worst. And the red zone is unhealthy for all of us. And so all of us should be thinking about trying to moderate our activity, to stay inside, to minimize how much outdoor air we're breathing. And in the purple and maroon zone, that's really when we need to think about our action plans and what we're doing to keep our indoor air as clean as possible. This is available in a whole bunch of places. The weather app is my kind of go-to reliable source. It's available in multiple languages, and the color codes make it really easy to understand what's going on. Even if reading comprehension is not your strong point, the colors really give it good guidance. Next slide. So when I'm talking to patients in clinic, I go over the AQI. I also talk about what we do when the air quality really gets into that red and purple zone and kind of how we think about it. And for patients who've got chronic lung disease like asthma or COPD, it's really important to have a wildfire smoke action plan. There are some really good resources available online. Vancouver, BC has a great one. Americas also has a great one. I think we're going to talk about that shortly. But they can really help kind of guide this conversation and provide a skeleton or a template to follow when we're talking about patients with this in the clinic. My general thing I kind of cover is A, where to find wildfire alerts. So where to find the air quality, where to know about wildfires, what medications people should have on hand, and when they should bring them in their go bag. So things like an albuterol rescue inhaler, for example, their maintenance inhaler, potentially some steroids, depending on how bad their asthma is. All things that can really help to kind of pack the bag and have it ready to go if you need to evacuate, or if you need to leave somewhere else to go to someone else's home, for example. We talk about when to use albuterol and how frequently to use albuterol. And then we develop an air quality action plan, particularly for asthmatic patients, about when to start taking steroids, when to track your peak flow, when to go to the hospital, which is really important because people are often less or reluctant to go to the hospital when a wildfire is happening because they worry about going outside. And for patients who are on supplemental oxygen or who need dialysis, thinking about what the worst case scenario is. So say you have to evacuate, say a fire hits your area and you need to leave. What are you going to do? How are you going to bring your oxygen? Where are you going to go to get dialysis? If you lose power, how are you going to run your oxygen? How long can you run your oxygen for? Where will you go? And which emergency room is closest if you lose power and you can't maintain your oxygen supply? These are all really scary things to think about, but they're really important things to think about because when it happens, often people are in panic mode. And it's not easy to find resources at the last minute. So preparing ahead and talking about it ahead of time can really empower patients to make some decisions and kind of plan ahead for this sort of thing. Next slide. The other thing I talk about in clinic is how to make your indoor air as clean as possible. And there are some really great resources up at the EPA, at least currently up at the EPA, about how to make a clean room for wildfire events. Things like running an air purifier, closing windows, avoiding doing things that can make the air quality worse. So cooking, for example, burning candles, burning incense, spraying air scents, and then thinking about where in your house you should be to stay as cool as possible at the same time, because a lot of patients may be reliant on window air conditioners and units like that, where they may bring in a fair amount of outdoor air pollution while trying to cool the home at the same time. There are also some great resources online about how to make your own DIY air purifier, which is much more affordable. Next slide. And then finally, big picture wise, I think it's really important to recognize that right now, our outdoor workers, particularly our farm workers, are not protected from high heat and high wildfire smoke days. And while there is some policy at the state level, California in particular is a really important first step. We need ways to actually enforce these policies, and we need federal standards for heat and wildfire smoke really urgently. This is only going to get worse. Next slide. So in summary, wildfire smoke is really a major and a growing driver of air pollution. It's bad for us, and the more we're exposed, the longer we're exposed, the worse those outcomes are. Farm workers and our outdoor workers are really at increased risk of health complications. And we need both action in the clinic and action at a policy level to think about how we keep workers safe from high heat and from high wildfire smoke days. With that, I will switch over.
Thank you so much, Dr. McMurdo. And you set the stage very nicely for our next speaker, Nate Matthews-Trigg of AmeriCares. So Nate, over to you.
Thanks, Jessica, and it is an honor to be here today to speak with you all about the work that AmeriCares is doing to support frontline clinics and health centers. So my name is Nate Matthews-Trigg. I'm the Director of Climate and Disaster Resilience at AmeriCares. And AmeriCares is a health-focused international relief and development organization. I think we're most known for responding to large disasters, but we do a lot of work supporting clinics and health centers build the capacity to respond to increasing extreme weather events. Next slide, please. So the mission of AmeriCares is to help people and communities around the world access health in times of disaster, but also in everyday life. And that's why, our critical partners are those on the front lines providing primary care services and the critical frontline services needed, which you all provide as health centers. Next slide. So when it comes to health centers, we know that the patients you serve, the communities you serve, are often those most vulnerable to the impacts of extreme weather events and wildfires and wildfire smoke. We also know that these are the communities that have contributed the least to climate change, which is driving the risk of many of these hazards. AmeriCares partners with over 1,000 clinics and health centers across the US, but we also work globally, and we have partnerships with over 4,000 clinics globally. Next slide. So AmeriCares about 4 years ago partnered with Harvard Center for Climate, Health, and the Global Environment to do a nationwide survey of clinics and health centers to understand how extreme weather events were impacting their operations and what sorts of services we could provide to help them prepare and become more resilient. Next slide. So the survey was conducted. We had over 500 respondents to the survey. These were people working at clinics and health centers at every level. We had providers, administrators, community health outreach folks respond. And what we found was quite sobering and shocking. We found that only 15% of all of the health centers and clinics that responded felt very resilient. Many were reporting, about 50% were reporting expenses from extreme weather events to their operations. And we know how clinics and health centers operate on such small budgets that any operational expenses would mean pretty dramatic impacts to these facilities. Next slide. We also asked what sort of resources could we provide, both for clinicians to understand kind of how climate change and extreme weather events are impacting their patients' health, but also what sort of materials do they want to share with their patients? And what we heard was there's a real need for basic, brief information sheets, both for the providers, but also for the patients. Next slide. And this led to the development of the Climate Resilience for Frontline Clinics Toolkit. Next slide. There's a video. I think we'll post the link in the chat to it. Perfect. Thank you. Next slide, please. So this toolkit was through a multi-year collaboration between AmeriCares and Harvard Chan Center for Climate, Health, and the Global Environment. We received funding from Biogen to put this together. And really, it's an innovative suite of resources which provides materials for clinic and health center providers, their patients, and their administrators. And we take a patient-centered approach at how we develop this toolkit, in which we identify specific actions and recommendations for patients based on their unique health needs. Next slide. So after developing the toolkit and getting it out there, we then were able to do an evaluation of the toolkit to understand how it was working and how it was being utilized by clinics and health centers. So we started with 19 clinics and health centers, and we did semi-structured peer focus groups. And then Harvard Center for Climate, Health, and the Global Environment did interviews with the clinics. And we had them very intentionally implement the toolkit in their operations over the course of a summer and provide us with feedback. What went well? What did they learn? How were they using it? I think, how could we improve it? And this map shows where the clinics were located, clinics and health centers, where they were located by those yellow arrows. And as you can tell, we really wanted to highlight clinics and health centers that were being impacted regularly by certain hazards, such as extreme heat, flooding, hurricanes, and wildfires. Next slide. Based on the feedback, we heard that clinics and health centers really liked it and they wanted more, which is exactly what you want to hear. We were able to expand on the toolkit based on this feedback, where we convened expert work groups for each of the hazards listed in the toolkit, which is flooding, hurricanes, wildfires, and extreme heat. And we were able to incorporate the latest research. We also built out infographics to support patients in quickly understanding information. We also provided information for caregivers of patients. We addressed points of confusion. This here, these images show some of those updated materials. We heard that people were confused around the CDC's list of symptoms regarding heat exhaustion and heat stroke. So we provided clarity on what that looks like. Even the images of how people are reacting to these heat-related illnesses reflects kind of how to best communicate what signs people should be aware of. And then we heard a lot of interest in additional materials. This included videos, an app, addition of more hazards such as tornadoes, and these are all things we're considering doing in the future. Next slide. The toolkit that I just talked about really focuses what happens within the clinic walls, between the provider and their patient or the clinic administrator. However, we also recognized that community health centers and clinics serve a vital role as a broader part of a community response to wildfire smoke or extreme heat. And that led us to think through what are the ways that clinics and health centers can be part of their community when it comes to responding and supporting those who are most vulnerable. Next slide. We have a great introduction video. This was released when we kicked off this project. I think we'll put a link in the chat so you can watch it later. Next slide. So this project we call the Wildfire Smoke and Heat Health Action Plan project is really how you can support your patients outside of the clinic or health center visit. We recognize that you all are trusted sources of information. You understand your patient's unique health conditions. You understand the barriers your patients face to accessing cool and clean air spaces. And you often have regular contact with people in a community that are often socially isolated and really can't be reached in any other way. So recognizing these unique strengths that you all serve, we wanted to create action plans that would help you identify ways to be part of your community response. Next slide. So to develop this project, we worked closely with clinics and community health centers to develop a list of resources that were informed by case studies that we had captured from around the country. We know that communities impacted by wildfire smoke and extreme heat are doing very innovative, creative, cutting-edge things, but these kind of things you're all doing are not being captured and shared. So we wanted to capture all of these case studies and let them inform the actions we could recommend to others. So with the small cohort, we developed these resources. We also heard that we would need an assessment form to help tailor these action plans to your unique patient populations, your resource constraints, and your staffing. We then developed these tools and we tested them out with 40 facilities across the US who really intentionally implemented these action plans and provided us with feedback. Then once we did that, incorporated that feedback, we then had 148 facilities also generate plans and provide us with more feedback. So this has been a very evolving process, but really to ensure that what we create is user-friendly, accessible, and useful to you all. Next slide. So this action plan, first you are asked to complete a brief assessment survey. This will ask you some basic questions about, where's your clinic or health center located? Who's a good point of contact? And then it starts asking, what are your resource constraints? What is your staffing? And what does your patient population look like? Based on how you select those answers will dictate what action plan you are given and what interventions we recommend. Next slide. So when you go through that, it will generate a plan for you, which includes 5 priority interventions based on how you selected those answers, but also based on the available research and evidence to support these actions. Next slide. And we're hoping to gather feedback from people that are using these action plans and put those case studies back into this. So we have this growing repository of action plan case studies. Next slide. Perfect. And by going to our website, you can actually fill out the assessment tool and get your own heat or wildfire smoke action plan. Thank you.
Thank you so much, Nate. And it's just incredible to see how these resources continue to develop over time and how receptive you all are to feedback and learning and growing. So just really appreciate these amazing resources. And to continue on with some great resources, we have Amy Liebman to share more about MCN's work in this space. Amy, over to you.
Great. So we have lots of resources that we're sharing with you because I think, as our speakers have pointed out, we are increasingly dealing with wildfires and high heat days. So I wanted to bring your attention to some of the resources that Migrant Clinicians Network has started with helping clinicians be responsive to wildfires. Next slide, please. So one of our newest additions to the resources is a Spanish language comic book that talks about respiratory health. So a lot of what we heard earlier is, how do you explain, like, well, why should you care about the air and what happens? We've put it into a comic book that's in Spanish, very colorful, that really uses simple language to help physicians, nurses, all kinds of clinicians, and community health workers really help patients and farm workers understand what might be the risks to them and how, most importantly, how they can protect themselves. Next slide, please. We've also put together a guide that is aimed at clinicians looking at wildfire smoke as an occupational risk factor. And so it's really complements the comic book that we just shared with you. And this also is more for the clinician and thinking about the different types of information the clinician may need to know about wildfires, and also about how they can help educate their patients about protecting themselves from wildfires. MCN did this in conjunction with Farm Worker Justice. Next slide. We also have a number of heat-related resources, and we have another clinician's guide on heat, and we also have training materials and resources that can help train community health workers, or community health workers can use to train farm workers and other workers. We have both construction work curriculum for construction workers and for farm workers about how to protect themselves from the heat, and also thinking about ways that, you know, what they need to know in the case of an emergency. So with these resources for workers and for patients, we're not trying to put the burden of responsibility on the workers or patients. We know that public policy is really important to helping workers and families stay safe. But at the same time, we like to use these types of popular education tools to help patients understand the whys and also the hows of what they can do to protect themselves. I should state that we also have in the works that's coming out next month is a curriculum focused solely on wildfires and respiratory health that complements our training curriculums around heat. So we like to have several layers of resources, some for the clinicians that they can use to help understand the hazards and what they can do about it, and then resources for trainers and outreach workers, and then comic books and other types of tools that they can give to patients and workers to help them understand and protect themselves. So these three layers is our approach to helping address some of these issues. And again, underscoring that we recognize that we don't want to put the onus of responsibility on just on the workers or the families themselves. We know that public policy is really important, but there are interim steps that folks can take, particularly when they are in immediate danger or may be in immediate danger. Next slide, please. And so I'll stop there and we can open it up to questions. Thank you so much, Noelle, for putting some of these resources into the chat so that you can easily access them.
Thank you so much, Amy. So I will move us over into Q&A. Please